All right. Today we're going to go over tarsal inversion and eversion. The landmarks are going to be the same for both inversion and eversion. The fulcrum is going to be at the anterior aspect of the ankle, midway between the malleoli. The proximal or stationary arm is going to be the anterior midline of the lower leg, using your tibial tuberosity as a reference point. And the distal or moving arm is going to be the anterior midline of the second metatarsal. The testing position, the patient is going to be seated with their hips and knees bent to 90 degrees of flexion, neutral rotation, and neutral abduction. For stabilization, inversion, you want to stabilize the tibia and fibula to prevent knee extension, external rotation, and abduction. For eversion, you're still stabilizing the tibia and fibula to prevent knee extension, internal rotation, and adduction. All right, so I'm going to do my best to show you this on myself. So just bear with me because I don't have a partner. You're going to line your fulcrum up with the anterior aspect of your ankle between your malleoli. Let's say about right there. Your stationary arm is in line with the anterior midline of your lower leg, using your tibial tuberosity as your reference point. And your moving arm is lined up with your second metatarsal. For inversion, you're going to move the foot into a little bit of adduction, plantar flexion, and supination. Line that moving arm up with the second metatarsal. And I got about 32 degrees of inversion. The normal end feel is firm, and the normal range of motion is 35 degrees. For eversion, we're going to do the same landmarks again. The anterior aspect of the ankle between the malleoli. Stationary arm is lined up with the anterior midline of the lower leg, using the tibial tuberosity, and the moving arm is in line with the second metatarsal. You're going to pull the forefoot into abduction, dorsiflexion, and pronation. Line up again, keeping that stationary arm in place. I don't have very much eversion. I have about 12 degrees. Normal is 15 degrees. And for eversion, the normal end feel would be either firm due to the tension in the ligaments in the joint capsule. There's a lot of ligaments in the ankle. And then also it would be hard if the calcaneus and the floor of the sinus tarsi come in contact. But it could be either. It depends on the person.